Good afternoon, Jeffrin Brickfield. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I have always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
How will you make a positive impact on the nursing profession?
There are different ways to contribute to making a positive impact on the nursing profession. Creating feedback forms helps us secure and promote our jobs and gives us the motivation to work hard. Nurses deserve better working standards and benefits for their hard work. Therefore, listen carefully to what nurses have to say to lighten the workload. Additionally, it provides continuing education for all to make us stay updated to be the best always.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you like most about your profession?
What I like most about my profession as a nurse is the opportunity to make a meaningful difference in people's lives every day. Nursing allows me to provide compassionate care and support to patients during some of their most vulnerable moments. The ability to offer comfort, alleviate pain, and promote healing is incredibly rewarding. Additionally, nursing is a dynamic and ever-evolving field that challenges me to learn and grow. I appreciate the collaborative nature of healthcare, working alongside dedicated professionals to deliver the best possible care. The relationships I build with patients and their families are deeply fulfilling, and knowing that I have positively impacted someone's health and well-being is what drives my passion for nursing.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning. I'm Jeffrin, one of the nurses here in the emergency department. I can see you're feeling quite uncomfortable, and I want to assure you that we're here to help. Could you start by telling me what brought you in today?
Good morning. Yes, I've been having this terrible chest pain since this morning. It came on suddenly, and it's been getting worse. I'm really worried it might be something serious.
I understand how frightening that must feel. Don't worry, you are in safe hands. May I know your name, please?
My name is Mihira.
Mihira, let's take a closer look at what's going on. Can you tell me more about the pain in detail?
It started about 2 hours ago, and it's been constant since then. It feels like a heavy pressure in the middle of my chest. It hasn't spread to my arm or jaw, but I do feel a bit nauseous and sweaty. I'm also finding it hard to catch my breath.
Thank you for explaining that so clearly, Mihira. It's important for us to understand all these details. Now, to help us get a better picture of your overall health, could you tell me a bit about your medical history?
I have high blood pressure, and I was diagnosed with diabetes a few years ago. I don't smoke, but I don't exercise much either. My diet isn't the best. I tend to eat a lot of fried foods. And yes, I've been under a lot of stress recently because of work.
Thank you for sharing that, Mihira. Based on what you've told me, there are several possible causes for your chest pain. Sometimes, it can be related to the heart, like angina, which is often caused by reduced blood flow to the heart muscle, or in more serious cases, a heart attack. Other times, the pain might stem from acid reflux, where stomach acid flows back into the esophagus, causing a burning sensation. Muscle strain in the chest area can also lead to discomfort, and sometimes, anxiety or panic attacks can manifest as chest tightness or pain. Because chest pain can have such varied causes, it's crucial that we take the next steps to understand what's happening in your specific case. To do this, I'd like to arrange for you to see a doctor for a thorough examination. The doctor will conduct some tests to check your heart's electrical activity or do blood tests to look for any signs of heart damage. Depending on the doctor's findings, they will then be able to recommend the most appropriate treatment plan for you. This might involve medication, lifestyle changes, or further investigations. Please know that we're here to support you through this process. It's important to address these concerns, and we'll work together to find the answers and get you the care you need. Mihira, try to remain calm, and we will get you the help you need.
What kind of tests will I need?
That's a good question, Mihira. We'll likely start with an ECG to check your heart's electrical activity and some blood tests to look for markers that might indicate heart damage. We may also do a chest X-ray to rule out any issues with your lungs or other structures in your chest. These tests will help us pinpoint the cause of your pain and guide the next steps in your treatment. Do you have any other concerns or questions about the tests or anything else?
No, I think that makes sense. I'm just really worried about what's happening.
Mihira, I want to assure you that you'll receive the very best care throughout this process. We understand that experiencing chest pain can be unsettling, and we're committed to ensuring your comfort and well-being. Once you see the doctor, you'll be closely monitored. This means they'll pay careful attention to your symptoms, vital signs, and how you're feeling. They'll be there to answer any questions you have and provide reassurance. We'll make sure you get prompt treatment tailored to your specific needs. If any tests are needed, we'll make sure they are conducted quickly and efficiently, and the results will be reviewed thoroughly. If any interventions are necessary, such as medication or further procedures, these will be explained to you in detail, and you'll be involved in every decision. We'll prioritize your comfort and safety, and we'll be there to support you every step of the way. You won't be alone, Mihira. Our team is dedicated to providing you with compassionate and comprehensive care, and we'll do everything we can to help you feel better and address the cause of your chest pain.
Thank you, Jeffrin. I appreciate your help.
You're very welcome, Mihira. We're here to take care of you.